the mild, I guess, the moderate depression being a lot more common. What do you tend to lean towards nowadays in terms of more of the holistic stuff? I definitely want to cover the medical food side of things because I find that absolutely fascinating. And I mean, just in general, approaching this one, it's usually okay, pharmacology, what kind of meds should we offer the patient? Lifestyle management, like, are you still isolated after COVID, or do you need to go to the gym? Do you need a boyfriend, etc.? And then we've got the counseling and the psychotherapy and the talk therapy. Like, how do you actually approach a patient who's in that much more common mild moderate side of things with the okay, let's start doing some of the stuff that doesn't have as many side effects, when these pieces often have, again, paucity in the research, probably just due to lack of commercialization interest around a lot of them.
That's part of it. In fact, if you look at the literature, there are probably 20 to 30 natural substances which appear to have some efficacy in the treatment of depression. And so it's all out there. There's a wide ranging literature. A review that came out several years ago indicated that if you really do a sort of a critical study of the literature, there are only four nutritional items that appear to have demonstrable efficacy in the treatment of depression. And so I'm sorry, I'm veering into medical food too early, maybe, but it's
Let's go there.
that's that's what's out there. And those four substances are the amino acid known as S-adenosylmethionine, the form of folic acid known as methylfolate, which again has a reason for being, and fish oil. In particular, fish oil containing a lot of the EPA omega 3 as opposed to the DHA. Weirdly enough, DHA is very important for growing babies and pregnant mothers, as well as for old folks to try to maintain their cognitive status. Whereas in the middle of life, EPA is the relevant omega 3 for reasons that we're not sure about. The fourth item is vitamin D. And here again, this is a really unrecognized thing to some extent because it's so trivial and it's already out there. So people can't make a lot of money on it. But if your vitamin D level is low, you have a 4 times chance of becoming depressed compared to someone with a normal vitamin D. Same is true of vitamin B12. Pretty much a similar story. And so those things are out there and they're low hanging fruit. I mean, for a clinician, I do blood tests, obviously. I check the levels of vitamins, I check the thyroid function of the patient, basic chem screen, anemia, things of that sort. Once you're done with all of that, you really are left with this small basket of potentially useful things, which, key term, is not harmful. We do not do harm with this basket. And so, I've really come around. I mean, I used to be, kind of a mad psychopharmacologist in my youth. I mean, we're all very enthusiastic, when we get started in this business. And I would just, get people on antidepressants. If they're not better, I'd add an antipsychotic to the antidepressant. If that's not better, I'd add some thyroid hormone. If that's not better, then they get ECT. That was my practice in the 1980s. Lately, and especially here again, this is where the humility grows. You watch patients that you get to know for more than just a few months. You watch people go through the life cycle of depression for 10, 20, 30 years, and you become very respectful of their life experience and what it is that they feel when it comes to getting treatment. And all of this kind of led me in the direction of trying to optimize these do no harm treatments, which clearly have efficacy in treating depression.